Hello again, everybody. Welcome to another edition of The App. This is our KTBS political podcast. The App, in this case, has nothing to do with computers. It stands for ARKLATEX, People in Politics. We have a couple of very special guests with us today. In the studio, right here to my right, Dr. Wyche Coleman, Louisiana's Deputy Surgeon General. I got that right?
You got it right. Yeah, okay. Thanks for having me.
Now here's the big boss.
Big boss.
Dr. Ralph Abraham, the Surgeon General for the state of Louisiana. Doc, thanks for being here.
Hey, thanks for having us, Jeff. I always look forward to these conversations.
Well, you're one of the finest people I know, and I feel like I know you intimately because you played around in my eyes. You've had your fingers in my eyes. So, anyway,
yeah. And fortunately, you're seeing well.
I am seeing well. Yeah,
right.
Yeah.
Good news.
So that is the good news, isn't it? Listen, we got all kinds of things we want to talk about, Doc. If you don't mind, let's start with the measles outbreak. What's been going on with that, and give me your take on what's happening with the measles.
Well, as everyone knows, we had a major outbreak that started in Texas. It spread to several other states. We now have, a couple of confirmed cases, and have done some contact tracing. Our team at LDH is doing a wonderful job, and we're watching it closely.
Is this how concerned? Why should we be about this?
I don't think we should be too concerned. I think most people have been vaccinated for measles as a child and probably have good immunity. So I think that the most of the outbreak is in the unvaccinated population. I think that, like many things, this is a symptom of a greater problem, that in COVID, a lot of people lost trust in their doctors, and so they quit going to doctor's visits. And we'd like to get people going back to doctor's visits. And so the childhood vaccination rate's going down. And part of that is because if you go to your doctor's office and they tell you, give your 6-month-old a COVID vaccine, then I think that a lot of parents don't listen to anything else after that. And we don't think that's a very good idea either. And I think that the declining vaccination rates for some of these core vaccines that have been around for a long time and have a pretty good safety profile and prevent deadly diseases are a collateral damage of the pressure that was surrounding the COVID vaccine. So we'd like to get people back in the doctor's office, restore the doctor-patient relationship, and I think that would help the situation and get people back to the routine vaccinations that are important for population health.
Ralph, when I was a kid, which feels like about 1,000 years ago at this point in time, I had the measles. I remember having it vividly, and I've had since, obviously, the vaccines. Are those still good? Do I need to get a refresher or a booster?
No, you should be good. Usually, if you've had the measles or you've had the 2 vaccines, you're good for life. If there's any question, and there are patients where, we do question their immunity and their ability to transmit the disease, there's a blood test that we can see if they are immune or not.
Now, when you're an older dude like me and you get the measles, that's a lot more serious than when you're 8 years old, isn't it?
It can be. Measles is a highly contagious entity. And it can develop quickly, both in children and in adults, to pneumonia, some encephalitis, some pretty serious conditions. So we tend to look at the very young with a more, vigilant type of overwatch. But to that point, certainly adults that get the measles, as has happened, across the country in a few of these cases, we watch them close too.
The controversy, I guess is the word I'm searching for, controversy over vaccines. There's been a lot in the last few years. How concerning is that?
Well,
or should we be concerned, or is that just a lot of propaganda?
I think it's a debate that's going to happen. I think that there was a lot of problems with the COVID vaccine that weren't admitted,
right.
And then that's led to a lot of distrust. I think that was where a lot of the distrust started. And so there's a debate happening in the public sphere about vaccines, and I think that we would like to have more safety data surrounding all of them. You'd like some more placebo-controlled trials. We'd like more assurances. And I think the public would like that. When I say we, I don't necessarily mean this is my personal view, but I think this is the way that the political conversation is going in the nation, where this conversation's happening. And I think that a lot of the mainstream in medicine says, well, let's keep saying safe and effective over and over again. But a lot of the public's not buying it. And there was this interesting study that showed trust in doctors and hospitals went from 72% in 2020 to 40% in 2024.
Wow.
That was a huge decline.
Yeah.
And so I think that at some point for that to come back, for people to trust doctors again, we're going to have to engage people with the issues that are important to them, and vaccines are one of them. But I think that the childhood schedule, especially the core ones that have been around for 30 years, those are important, and we should try to encourage people to get back to taking those.
Well, can I tell the story about when I first met you? Like, I came in there to get my eyes checked because I could hardly see anymore.
Yeah, go ahead. They're going to love this one.
First thing's going over my medical history doc. He says, have you had COVID? I went, yeah. He said, did you take the COVID vaccine? I went, no. He goes, you're brilliant. And I went, okay, well, I'll accept that. Why?
I said you outsmarted me.
and you told me why, right?
Yeah.
Tell us what. Explain.
Well,
Or
you know,
you might, if you don't want to, you don't have to.
yeah, you know, I had a few complications. I ended up taking it, and I was the only member of my family who did, and I had, you know, myocarditis, pericarditis, or something from it that took a while for me to get over, and I thought it may kill me at some point.
Yeah, wow.
And it sort of opened my eyes and said, maybe this thing is not so good, especially for young, healthy people.
Mm-hmm. Well, we're glad you're with us still.
Oh, thank you. I'm glad to be here.
Doc, what about ivermectin as a treatment for that? Or should we trust it? Or, I mean, there was a lot of negative publicity about it.
Yeah, I trusted it, and I used it in several of my patients, and had some really positive results from it. Ivermectin's been around for several years now. It was initially, as everyone knows, developed for anti-parasitic type conditions, but it has been shown to have some quite impressive antiviral qualities, along with some anti-inflammatory qualities. So you see a lot of people now that are using it. They're getting it from various sources, some from the veterinary supply houses. But right now, I think we're over 4 billion prescriptions worldwide, and it's turned out to be a safe drug.
Ralph, what was with all the negative pushback? Was that simply politics?
It was. Again, when I and other physicians were using it actively to treat some very sick patients, we got a lot of pushback from people, mostly on the national level. And of course, as everyone knows now, looking back, COVID was very politicized, both from federal agencies, CDC, FDA, but it even trickled down to the local levels. I got to the point where, or a lot of us got to the point in Louisiana, where if we wrote a prescription for ivermectin, then the pharmacists, certainly some of the big box pharmacies, would not fill it. Now, ivermectin is FDA approved for human use, not for COVID, but for lice and parasitic conditions. Luckily, our good governor, who at that time was our great attorney general, stepped in and helped us, allowed us to be the doctors that we are, and to get our prescriptions filled for these patients that, again, I think it benefited many of them very greatly.
What's your view on the use of ivermectin?
I think that there's a lot of people who think they benefited from taking it, and there's a lot of doctors that think that it benefited their patients to use it. Yeah. It's one of those areas, like this is true in many areas of medicine. There's a lot of different opinions. There's a lack of consensus, and some people pretend that there is great consensus on issues. And the vaccine topic's one of them. I think that science is defined by a lack of consensus, and we need more open debate because there's a lot of different opinions. Sure. But I do think in the case of ivermectin, what was so problematic is you had a licensed physician writing a valid prescription, and the pharmacist just chose not to fill it. Mm-hmm. And they said, well, it's because it's off-label, but off-label drug use has been around for a long time. There's great precedent for it. For example, all of the drops you used after your cataract surgery were off-label. Not one of those is for cataract surgery, inflammation or infection control. So many drugs, really almost every drug, is used for things that it was not approved for. So the approval is usually very narrow, and it proves there's safety in the prescribed dosage, but it only shows efficacy for one little tiny thing. So it may be efficacious for a lot of different things.
Okay.
And it never makes sense for the companies to go and try to seek FDA approval for all those things, because they'll never make a return on their investment. So they prove the safety and they prove efficacy for one thing, and that's the on-label use. But then there's many off-label uses like steroids and antibiotic drops for inflammation and infection control post-cataract surgery. That's not what they were approved for. They were approved for different things.
Okay.
And so almost everything that I use in ophthalmology is an off-label use. There's a few that are on-label, but we do a lot of off-label. It's well established, and I think that part of the bill to make ivermectin over the counter, number one, we'd like to keep people from having to go to the feed store and get the veterinary doses. They should be able to get it in human form in a dosage that we know is safe. But more broadly, the principle that was violated is saying that you can't use drugs off-label, and definitely we do, and you should be able to, and I don't think it should be restricted.
Yeah. Listen, I guess the broad question I want to go to here is should politics be involved in medicine? One of the when I first came, again, other than that other story I told, we sat there for like 40 minutes and you talked to me about politics. I'm like, what's with this guy? I just came here for cataract surgery.
Well, I watched your show.
But
I was interested.
Well, I appreciated that. But he was talking to me, Ralph, about you. And then I came to find out you guys are great friends. You're pilots. You do all these things together. You fly these humanitarian missions. You're quite a guy. For those who don't know, you're a former United States congressman, and Wyche followed your career and considered you to be one of his great friends. And now it's kind of, life going full circle here with Ralph as Attorney General and you as his deputy, or Surgeon General, I should say, and you as his Deputy Surgeon General. I just find that kind of funny, the way life all works out.
It's an interesting turn. It keeps things interesting. Hanging around Ralph keeps things interesting for sure.
Well, Jeff, to your question, no, I don't want politics in my exam room. That's a very sacred bond and trust that a patient and a physician have. I've said it many times. I have patients that tell me things that they don't even tell their spouse. I mean, that's how tight that trust is. And I don't want big pharma. I don't want government. I don't want anybody that has any type of influence, certainly an outside influence, to even be in the conversation I have between me and my patient.
Yeah, I would agree with that, by the way. One of the things happening now is we have a new head at DHS, and that's Robert Kennedy Jr. He's taking on a lot of things, but one of the things he's interested in is the food supply in America, and I guess for just me speaking plainly, trying to clean it up, getting rid of some of the things like food dyes, et cetera, that are in the supply, and get rid of those, especially for kids. Ralph, what are your thoughts on that?
Absolutely. We have been doing the same thing in the United States for decades. And we spend probably more per capita on our population for healthcare, but where we rank globally is pitiful. So something is not working. Something has not worked for a long time. So I applaud RFK Jr. At HHS to at least bring this to the talking point, to the talking level that he has. People are listening. We have some wonderful legislatures that are bringing great bills in this session. Senator McMahon is one of those that I will mention. We've got what are called the Maha Moms in Louisiana that are a powerful force, both politically and just on the ground level, making those types of requests from the legislature to get our food source healthier. And again, I'm all in.
And I guess one of the ways that folks want to accomplish that, Wyche, is through limiting certain choices in SNAP benefits, right?
Yes, that's one of the ways, and I think that we've had a system that economically incentivizes unhealthy choices, and we need to change the system so that we economically incentivize better choices. And I think that some people say, well, you have people who are that are not educated, so they buy bad food. I don't think that's right. I don't think anybody wants to be unhealthy, like Doc says all the time. I've never met anybody who wanted to be unhealthy.
Sure.
But I think that if that's the cheapest source of food, and you're having to use a limited income, especially with SNAP benefits or the federal programs, you need to buy the most calories for the least dollars. to be able to live.
Okay.
So we should try to get the healthier choices, the lower sugar choices, because that's really the problem, is the big sugary drinks that are the cheapest.
Yeah.
We need to try to get the healthier choices on plane, or even better from an economic perspective with the unhealthy choices. And if we can do that, I think people will make healthier food choices, and I think that we'll see a big improvement in population health. I think that's low-hanging fruit. It's a big opportunity for the state.
Makes complete sense. Ralph, how big a problem is all the sugar in our food supply?
I mean, look at our population, Jeff. Our obesity level is, I think, in the 40%, maybe even higher than that. And even more important than that to me is the obesity level of our children, our preteens, our teenagers.
Yeah.
I treat from 1 day old to 100 day old, and it it does two things. It saddens me, but it also makes me angry when I see these obese children that already have high blood sugar, high cholesterol, getting high blood pressure. It's like Dr. White said. It's not that the parents don't want healthier choices for their food for their children. Sometimes it's just not an option for them. So anything that we can do from the Surgeon General level, from the governor's level, from the federal level, President Trump, you see, he's all over this with RFK Jr. trying to get people's choices to a better place. So we owe this to our population, but we especially owe it to our children.
Ralph, what about the food dyes? That's a big topic right now that we hear. We want to get, I don't know, red dye number 2, whatever they are, out of all the food supplies. How harmful are those?
We don't know, but good. Again, I go back to RFK Jr. Good for him for bringing the debate and bringing the discussion. You're going to get so many groups, and you already see some of them opposing these moves to make America healthy again. Well, of course, most of them have vested interest, and we've got to get them out of the way. All they are is noise. They're cluttering the airwaves, and we've got to have data-driven, scientific data-driven data to make good choices. And until we allow that to happen, until we push away those that are obstructionists, then we're gonna have still a headwind. But we have got to get to a point where our food supply is much, much better than it is right now.
It is amazing, Wyche, that you got, I mean, obviously money is at the heart of it, but it's kind of amazing that you got people fighting back against healthy food.
Well, the food dye deal is sort of baffling to me. That's one that I don't really understand. Maybe those things are cheaper and they make products easier to sell because they're brighter colors and kids like that. But you'd think if there was any chance that these things could be harmful, and a lot of them are petroleum-based products, like some of the reds and yellow dyes, and petroleum-based products being added to your food just generally doesn't seem like a good idea intuitively to me.
It does sound kind of gross.
Not claiming to be an expert, but those things are. If we think there's any chance of harm, we might be able to accept our M&Ms being like one color, one shade less of yellow, and that's how they are in Europe. If you buy them in Europe, they banned these dyes a long time ago. So if you get M&Ms or Skittles or something like that in Europe, they're just slightly less bright shade of the color than they are here. But I think that that's a no-brainer. If it's a petroleum-based dye, we should get rid of it. We should have done it a long time ago.
I keep hearing that, or I've heard it a lot recently about the European model that Wyche mentioned of food. Is that something that American food supply should aspire to, Ralph?
Yeah, absolutely. If the data shows that it's healthier, heck yeah. There's many things in Europe I certainly don't want to emulate, but that may be one that we do want to look at very closely. And if it's a better product, let's do it.
I want to ask both you guys about, Ralph, let me start with you on this one, and that's I don't even know if I'm pronouncing right, whooping cough.
Yeah.
That was a big deal not too long ago, that seemed to be going around. Is that kind of calming down now?
Well, we're still seeing a lot of cases of it. Right now, the last data I saw, there were like 155 cases in Louisiana already to date. And that's, I think, if my memory serves me, I think that's more than the total cases last year. So yeah, it's still a big deal.
How harmful is that to any individual?
it can be very tough. It can be deadly to infants. So we take it also, like the measles, very seriously in everyone, but certainly those children that are a year or less. We watch them close. To the whooping cough,
Hmm.
about a third to maybe 40% of those less than a year that get the whooping cough will have to be hospitalized.
Wow, I guess I didn't realize it was that serious.
Yeah, it's serious for youngsters.
Okay. Another topic I wanted to hit on was fluoride in the water. I feel like I've been hearing about this since I was about 5 years old. Some said it was a communist plot. I remember reading that back when I was probably 6 years old.
Yeah.
I mean, I don't believe any of that. But what's your thoughts on that?
Well, there was a couple of very good studies that were high power that came out that said if fluoride exceeds a certain level in the water supply, it reduces IQ, especially in children. So that was bona fide. This has been proved in court.
Okay.
So the question is, what does it do at a lower level than that? Mm-hmm. And the answer is we don't know. Does it reduce IQ a small amount that is difficult to prove in a study? And I think that it could. It's plausible because we know at a higher level, and this is at higher level than any exists in any water supply in Louisiana.
Okay.
So that would be true to say. But at a higher level, we know that it reduces IQ. So I think that if there's any chance that it reduces IQ at all, because 1 point of IQ reduction across the whole population is a major problem.
Yeah.
That would be a problem for the national security and everything else. So if we think that it might, then now we have a question that what do we value more, teeth or IQ? And I think I would lean in the direction of IQ and deal with the teeth problems that it may cause.
Yeah. What do you think about that, Doc?
I don't want to mandate it to any municipality or really anybody. I think it should be decided on the local level by the local people. And, if they want it in their water supply at a level that right now we call acceptable, well, so be it. But again, to Dr. Wyche's point, there are other ways to get fluoride to, protect teeth. So when you have a product that you pour into the water that has skull and crossbones on it, and which just fluoride does, you need to take notice and maybe be a little more careful as to what levels that are actually being put into your water. I mean, you put it in at the front end, and it goes all the way down range to the end of the pipe. Yeah. So, do you have a higher level at the beginning than at the end? Yeah, you probably do. That's something that we need to look at.
Skull and crossbones might be a warning sign, right?
Yeah, it might be. And it kind of goes back to that point that, we think that people ought to have autonomy over their own bodies and what medicines and pharmaceutical products they're putting into them. So fluoride's one of those things, you don't really have a choice.
Yeah.
If they put it in the water and you got to drink the water, then it's sort of taking away some individual decision making. And in general, we'd like to get third-party interests out of healthcare, where someone else tells a doctor or a patient what they're going to have to do. There's many of them, and they've become so pervasive. The one that we can affect some change on is government, and we would like to minimize the influence of government in the doctor-patient relationship and try to restore decision-making where it historically has been in the hands of individuals getting the best advice they can from their doctor.
I think that's great advice. Doc, talk to me about how the Surgeon General's office, the office you currently occupy, meshes with the Louisiana Department of Health.
Mesh well. On the Surgeon General side, our role is mostly healthcare policy. When you get over to the LDH side, they have the heavy lifting. They have the hard work because they have to do Medicaid, and they have several offices under that that they have to manage. We've got a wonderful doctor that we work with very closely, Dr. Pete Krogan. He's phenomenal at what he does on the LDH side. There are a lot of things that we share, a lot of topics that intertwine. And fortunately, because we have such a great crew, we've got a new secretary with Bruce Greenstein he's hit the ground running, doing wonderful work already. Then I think there are blue skies ahead for Louisiana. We're going to move that needle and already have moved it significantly in some cases. But we're going to move that total. We're going to get out of that bottom of that 48th, 49th, or 50th place. And we're going to move up several steps here. And, I'll take a 40, I'll take a 35 right now. Everybody wants number one, but we're going to move up very quickly.
How important is Medicaid, Medicare in the state of Louisiana? Reason I ask, I just talked to Speaker Johnson about it yesterday. Keep hearing the rumors that the Republicans or Trump is going to do away with Medicare, Medicaid, all that. I mean, the Speaker says that's simply not true. That's not going to happen. It's important in Louisiana, right, Wyche?
Well, a lot of the population's on it for sure. And
Yeah.
I think that, in a broad sense, we've got to have economic growth in Louisiana. We've got to have job growth and population growth. And a lot of our problems come from population decline, job decline, and general economic decline. So if we don't grow the economy, none of our problems can be solved, healthcare included. If we do grow the economy and we can get population increase and we can get people on private insurance and off of Medicaid, a lot of the problems are going to solve themselves. And I think the governor's done well to focus really hard on recruiting businesses here and getting better jobs and bringing people back to Louisiana with the whole Come Home initiative. I think it's a great way to look at it. But we're dependent on Medicaid now.
Yeah.
I hope they don't make a big cut in it. The system is set up to where it would really be shockwaves going through it. But I do think long term, at some point, the federal government's going to run out of money.
Yeah.
And so that's the reality. So they're going to need to, try to prioritize. And that's one of the places they may do it. But I think they should be real careful of how they do it, because I think it could have ripple effects in the system. It doesn't need to be a fast change.
Ralph, as a former U.S. congressman, you might have a little more insight into that. What are your thoughts on that's the Medicaid, Medicare situation?
Yeah, I mean, Jeff, I'll hit it from the personal level first. I've got many patients that were on Medicaid. Right now in Louisiana, we have about 1.6 million of our population on Medicaid right now. But in my parish, Richland Parish, the governor and all our wonderful people up at that level have brought Meta into my parish. And it has been a game changer from the get-go. I've had, I don't know, 20 or 30 patients just in the last 3 or 4 weeks that have been able to move off of Medicaid, get that private insurance, because we've got these wonderful jobs that are popping up.
Yeah.
Wyche is right. Governor Landry's doing great. He has brought LNG back. He's brought car manufacturing back. If you look all over the state, these huge companies that have a lot of money, but as importantly, they have great benefits, they're popping up, and people are migrating to those areas so they can get those good jobs, and good for them.
And get on that private insurance. And a couple of years ago, you were here in Shreveport. You were presenting, you were doing a talk, or I forget where it was, but I came out and covered that. And it was about mental health and depression in Louisiana. Yes. Talk about that just for a second, and then Wyche, I'll ask you to comment on the same thing. But Doc, let's start with you.
All over the nation, Louisiana is no different than the rest of the nation. There's a mental health crisis. Again, I'll go give a lot of kudos to Dr. Pete Kroger in that area, because that's his specialty. There are many programs that we have at the LDH, some on the Surgeon General side, that are addressing this crisis. Let's get those patients into a facility, a doctor's office, anywhere where we can get them help. More importantly, once they get the help, we've got to follow up and not just forget them, because if we do, then they cycle right back to where they were at the beginning. It's a problem. There are solutions, and we're working on them.
And Wyche, do you think that economic growth, or I guess the lack of it in certain areas, contributes to that mental health crisis?
I think so. So, homelessness and mental health problems sort of go hand in hand. Mm-hmm. Homelessness is some percentage of your mental health crisis problems. That's people who end up homeless. And so that's closely connected with the economy and whether people have good jobs. But it's also one of the areas that's not well served by the private marketplace in healthcare historically in Louisiana. 20 or 30 years ago, we had a big state-run system. We don't have that anymore, and the private marketplace leaves some gaps. And I think that's one area that government really has a role to come in and try to fill the gaps that are left by the private marketplace. And so we're focusing at LDH on and Dr. Krogan's really the lead on that. And I think Bruce Greenstein's got some great ideas surrounding it too, to try to fill the gaps that the private marketplace does not fill using LDH and the government assets.
Okay. Listen, I know it's hard to believe we're down to probably our final couple of minutes here. I got a zillion questions I could ask you guys. Doc, what is the biggest health, not crisis, but what's the biggest challenge in healthcare facing Louisiana right now?
The governor has hit it on the head. We need to go from dependence to independence. And we've talked about some of those topics in this podcast here. That includes having the good jobs, having the good health care, having that doctor-patient relation reestablished, that trust reestablished, engaging with those patients, engaging with the population, not just on a one-time deal, but over and over until we reach that point where we know that we're making a big difference.
All right, Wyche, same question to you. What do you think is the biggest problem to healthcare-wise in the state?
Yeah, I would say that Doc hit the nail on the head as far as what the healthcare problems are, and what are the ones that we can work on in the short term. That's really the key question. And I think one of them is medical education, because we've ended up with a doctor shortage. We say we want the doctor-patient relationship, but if we don't have enough doctors, that's pretty hard to reestablish. Yeah. And in general, in medical education in the state over the past couple of decades, we've decreased our effectiveness at recruiting good people out of college to get involved in healthcare, to take healthcare jobs. We've let a lot of them leave after they finish a healthcare school, medical school, or nursing school, or whatever, and then leave and go to another state. And as a result, we've said we need to increase the number of these programs. But I think that really we need to focus on retention also. We need to take the top students who are interested in healthcare. We need to keep them in our state schools, and then when they're educated, we need to give them an excellent education when they're in those schools, and then we need to make sure that we retain them afterwards and don't let them leave. Because if we continue to just increase the number that we train, but we don't keep more of them, the problem's still not going to be solved, and we're going to have a shortage. So we've really got to focus on retention.
All right, thank you, sir. Doc Abraham, thank you so much. Dr. Ralph Abraham, the Surgeon General for Louisiana. Always a pleasure, my friend. One of the best people I've ever known, Dr. Wyche Coleman.
Yes.
All right.
Thank you, sir.
Thank you, sir. Thank you for watching this edition of the app, ARKLATEX People in Politics, wherever you get your podcast. It is available. Have a good one, everybody.